And your questions now around this baffling global pandemic continue to pour in. And so ABC Chief Medical Correspondent Dr. Jen Ashton is standing by with more answers for all of you. So, Dr. Jen, we'll begin with the first question. How effective and useful are homemade masks? I am seeing lots of offers for making face masks from designers to home sewers, but how effective are they really?
Short answer, Amy, their effectiveness is unknown. You know, from the beginning of this pandemic and outbreak, we've been saying it's just as important to say what you don't know as what you do know. And obviously, those made-at-home masks are untested. But when the CDC said that healthcare workers could use a bandana if necessary, I think at this point, it's probably better than nothing. So the Rosie the Riveters,
yeah,
I give them thumbs up for helping.
That's a fair answer. So this next question, because it has been confusing as well as to just how long this virus can last on surfaces. So the next question is, with all the concern about the virus surviving on surfaces, should we be concerned about our food being safe if we are ordering for delivery or takeout?
This is a tough one, Amy, because I've thought of that myself. I can tell you scientifically, if there is any, let's say the food worker coughed on your food and then you ate it, your stomach acid would likely kill that virus. However, if you eat with your hands, maybe not so much. But it's a balance because you want to support these restaurants when they are really struggling right now. So I've been trying to order in just once a day just to try to keep them going.
All right. Fair enough. The next question we have here, are there any over-the-counter medications we shouldn't be taking?
I love that question because it's about the caution with these things that are over the counter. There's so much interest right now in these alternative or complementary supplements. Could it protect us? Right now, there's no data on this. So you have to remember that if something can help, it can also hurt. Big organizations are saying, do not go to these supplements now. We don't know how they could interact with the virus. There has been some very early data, controversial, not peer-reviewed yet, that ibuprofen may cause an upregulation in one of the receptors that this virus binds to. So if you have a choice between acetaminophen and ibuprofen, probably go with the acetaminophen, but that is not peer-reviewed recommendation yet.
All right. Our next question, another question about the virus's life on surfaces. How long does the virus live on a bath towel? Should we be changing it daily?
That's such a good question. They don't know yet. They've studied this in the lab last week on surfaces like stainless steel, cardboard, plastic, and how long the particles linger in the air. The range was anywhere from 3 hours to 3 days. They don't know about money, clothes, bath towels. So if you are concerned, wash it more.
Yeah, when in doubt, just go ahead and throw it in the laundry. All right, our next question. Has anyone looked at the data from the people who regularly get the flu shot? Could this be why children seem to be less susceptible to the coronavirus?
I love this question, too, because it's really how scientists think. The answer is no. We haven't looked at that data yet. But basically, the flu vaccine is not going to give any protection against this coronavirus. However, it may be seen that people who have been vaccinated against the flu have less chance of serious complications with COVID-19, but we don't know. That's why we need that data to come out on our U.S. cases.
Yeah, with so much unknown right now, Dr. Jen, is there anything we can be doing that's known to be effective to boost our immune systems?
You know, you and I talk about this all the time, Amy. The best things you can do all the time, and especially now, get 7 to 9 hours of sleep, wash your hands as much as possible, and exercise, if it is possible, depending on where you are, has been shown to boost the immune system and has been associated with lower chance of various upper respiratory infections. So I'm doing push-ups in my apartment because I can't leave for the next week, but exercise is really, really important.
All right, so I'm going to challenge you to that push-up challenge that we've all been challenging each other around social media. So look for it later today. All right, Dr. Jen.
Awesome. You're on.
Thank you. And if you have any questions for Dr. Ashton, send them to her Instagram at Dr. J. Ashton.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.